Hello, I'm Dr. Surindher. I'm the Director of Cosmesis India. We are based in Brigade Road in Bangalore. Skin grafting is what most of the people understand of plastic surgery. Whenever you talk about plastic surgery, that is the most commonly understood procedure about plastic surgery. So it basically involves taking skin from another area of the body and putting it in another area of the body. This usually involves when you need to cover wounds. The wounds could be because of an injury, because of an accident, because of burns, or any other reason like diabetes, where you have a non-healing wound. So once there is a wound, you have to cover it with skin, and that is why you take skin from another area of the body, usually the thighs, and then you cover the raw area so that once the skin sticks there, it gives you a normal biological cover to the wound. Now, what do you do once the wound is healed and the skin graft is taken? It is important that you take care of the skin graft. Why do you ask? The reason being that the skin that we put does not have all the layers of a normal skin. Skin grafting, as we know, is typically called a split thickness skin graft. A split thickness skin graft doesn't have all the layers of the skin, it has only the epidermis and a part of the dermal layer. So keeping that in mind, since it does not have all the layers, so we know that it is a thinner part of skin, or it is a thinner layer of skin. So you have to take care of it. Because that skin graft is stuck onto another area, it is not going to be as strong and as normal as the normal skin surrounding it. So you have to make sure that you don't get injured in that area. You have to use moisturizers on it continuously, which will help soften the area and keep the skin graft supple. Because this skin graft does not have the appendages that are the hair follicles, so there is no oil secretion, because of which the skin will always be dry and it will be rough. So moisturizing and protecting it from injury are the two main important things that you have to do once the skin graft is taken or the skin graft is done. So this has to be continued for the next minimum of 6 to 8 months or lifelong, depending on the area where it is. Safety and preventing it from injury is lifelong. Moisturization, depending on which area it is, you have to do it from maybe about 6 to 8 months to about a year.